Thank you. Thank you. I
Great.
can hear you now. Yeah, I hope you can hear me. Yeah.
Yes, we can hear you. It's an absolute honor to be talking to you today, Dr. Devi Shetty. So you've heard it from everybody. He does not need any introduction. Dr. Devi Shetty has been driving a lot of reform in the healthcare industry, and all the accolades that you've received are not enough for the amazing work that you're doing in this space, Dr. Devi Shetty. So I know you're hard pressed for time. He was supposed to be here with us, and he had to attend to a very important medical emergency. So I'm so grateful that you still take the time to be here with us and answer a few of the questions that we have for you. So Dr. Devi Shetty, you've been at the forefront of innovation when it comes to healthcare and also making sure that healthcare is affordable for all. Now, if I just look at some of the work that you've been doing also together with IIT Kanpur, you're working on an artificial heart. So think about it, ladies and gentlemen, in terms of what this can mean in terms of for people who are waiting and people who are their loved ones who need a heart at an affordable price. So please tell us a little bit more on what this means, and also would love to hear your thoughts on what you think about India as the nation offering disruptive innovations for the world.
Thanks, Sindhu. In India, we suffer from an inferiority complex. We always feel that there is a limitation on which what we can do. Traditionally, when an Indian hospital groups does well in India, they generally think about going to Middle East or Africa and trying to expand. But we never think that we can go to US and build a hospital. So this is the complex we have. Similarly, in technology, when we think about coming up with some technological tools, we always think, okay, why not we make one ECG machine or a oximetry machine or a thermometer? We never think about why not we do a robot for the heart surgery, or why not we make the artificial heart? Because we have the capability, we know how to do it. It's just that we lack the mindset. So I thought, I've been dealing with the IIT Kanpur for some time. I was truly amazed by the capability what these institutions have. And as you know, India requires the largest number of artificial or a heart transplants because we are the largest country in the world. And you will be surprised to know that an artificial heart called LVAD, left ventricular assist device, costs about 70 lakh rupees to a crore rupees. And it is made by just one company in the world. So what is an artificial heart? Among all the human body, human organs, heart is the easiest organ to replace because heart has no intelligent functions. It is a pump. You pump in 5 liters, it will pump out 5 liters. You pump in 4 liters, it will pump out 4 liters. And I thought that we should really think about building an artificial heart which will be far, far ahead of what is available in the world today, and it will be affordable. The idea is not to make the cheapest artificial heart. Idea is to make the world's most advanced artificial heart, and I am very convinced that the team at IIT Kanpur, within 1 to 1.5 years, maximum 2 years, will have the world's most advanced artificial heart. I am confident about it.
That's absolutely fascinating to hear, Dr. Devi Shetty. I mean, I think many of us in this room thought that our heart takes a lot of the decisions, but we heard it, it's a pump, right? But brilliant to hear that something that costs a crore, you've brought it down to make it affordable for everybody who is in a dire need for a heart. Now, Dr. Shetty, I'd like to move on to, I think today we had some fascinating stories on technology and how technology is revolutionizing pretty much every industry, right? And if you think about it, today technology is reimagining ways in which we do things, ways in which we work, and many things which we can't even fathom anymore in terms of what could be the possibilities. But looking at medical management, tell us a little bit more on how is technology really helping drive some of those life-saving decisions for many of the healthcare providers?
Before going to the clinical part, let me make a very bold statement. India will become the first country in the world to dissociate healthcare from affluence. India will prove to the world that the wealth of the nation has wealth of the nation or the wealth of the family has nothing to do with the quality of healthcare its citizens will enjoy. Now, you must be thinking it's going to take another maybe 20 years, 30 years to happen. No, it is going to take less than 5 years. The richest man, what healthcare he can afford, the poorest man from the slum will be able to have the same treatment. Now, how this transformation happens? This transformation happens because the digital journey many hospitals, including ours, have taken will dramatically change the way healthcare is delivered. More than 70-80% of the consultation between the doctors and the patients will happen online. Last 3 years, I have hardly visited our ICU. I go to bed around 10:30, 11 o'clock at night. Before I go to bed, I do the ICU rounds sitting on my bed. I can see the patient, I can see all the data, I can talk to my doctors. And first thing in the morning when I get up at 4:30 in the morning, I do the ICU rounds. I can be in any part of the world. I can see whatever I want to see about the patient, wherever I am, whenever I want to. And these are the technological marvels which is already available in India. And the missing link is people do not have the money to pay for the healthcare. But that will be disrupted with all the changes IRDA, insurance regulatory authorities are bringing about. There will be large number of health insurance companies coming up, which will have different affordable packages, and that will create a magic. Because most Indians do not have the money to pay for the health care when they need it, when they get admitted to the hospital. But they have money to pay for the health insurance. I will just give you an example. I see large number of kids with heart problem. And when I tell the mother that the child requires operation, they have only one question. That is how much it is going to cost. If I tell them it's going to cost 2 or 3 lakh rupees, which they don't have, they cry. They request you to reduce the price, help them. But in the end, they will always tell me that, Ami, 1 lakh dete pari. I can give you 1 lakh rupees. These are the real poor people. And they can afford to pay 1 lakh rupees to save the child's life. Imagine if I have a health insurance today with a premium of 10,000 rupees per year for the whole family, and it is possible to offer a health insurance for the whole family for 10,000 rupees. If I have a insurance with a premium of 10,000 rupees, this lady has enough money to pay the premium for the next 12 years. But we don't have the insurance. And this is what is going to bring about a massive shift in the way healthcare is delivered in India.
Thank you, Dr. Devi Shetty, for those insights. I think it's very fascinating to also hear how you leverage technology to kind of monitor your patients in the ICU and kind of get prepared for your next day at work without having to even directly meet the patients to find out their vital stats. And talking about vital stats, I think we'd all agree in this room that all of us are fans of data, right? We like to measure everything. Today, there's so much of data that we can measure with our phones, with our watches that we carry on ourselves. But if you look at the exciting aspect of the whole world of business intelligence and the data that has an impact on a healthcare provider, Dr. Shetty, how do you see the whole area of business intelligence changing healthcare in this year, but also beyond?
I'll give you our real life experience. We look at the what's happening in the hospital wards, not the ICU. The ward nurses in India, ward nurses in England or US, they're not happy with their job. They're not happy with the job because they come for duty at 7 o'clock in the morning, take one BP apparatus, thermometer, go to the first bed, and they check the blood pressure, temperature, wait for a minute to count the respiration, then all the other parameters, about 5-6 parameters they check and they write it down on the chart. That takes about 10 minutes to 15 minutes. Then they go to the next bed and the next bed. If there are 30 beds in the ward, by the time they finish that mundane, boring, repetitive job, it's a time for her to do it again. And that is not the ideal. The ideal is 12 o'clock at night when she goes to the bed and tries to check the blood pressure of the patient. First thing the patient does is to scream at her because she has woken him up and he can't go back to sleep again. So nurses dread doing the rounds and checking the vitals at night. So nurses in India, nurses in England, all over the world, after 10 o'clock, whatever they are entering, quite not all the time, sometimes not very accurate. They lie. Why they lie? Because they don't want to be cursed. If they don't enter, the next day they are pulled up. So we have created a system in healthcare forcing conscientious people to lie because we haven't changed the process. Now, what we are trying to do, you just put a ECG patch that will give real-time ECG, blood pressure, temperature, respiratory rate, oxygen saturation. With a nurse's station will have a TV with the risk score of what is the possibility of this patient developing a cardiac event in the next 24 hours. So based on the risk score, only nurses will choose to see the patient. They don't need to do the repetitive job. That will dramatically change her way of looking at the profession. She will start enjoying the work. When she goes to see the patient, she is going there to find out what is going on, not recording all this mundane the data. So this will be a game changer. How it will be a game changer? It will virtually eliminate cardiac arrest happening in the ward completely. So we can anticipate the cardiac arrest well in advance. This is the advantage of the technology.
Fascinating. And I think we all agree with the fact that the job of nurses is something that we are all super grateful for. And we also do agree that sometimes there are those moments of irritation when you are deep sleep and somebody, but I think this technology that you just outlined to us clearly completely avoiding cardiac arrests in the hospital is something that I guess needs to be used everywhere. Dr. Devi Shetty, you talked earlier about making healthcare affordable for all, and you talked about income levels and what people are try to do to save lives. And I think recently you also launched Yashaswini together with the government of Karnataka. And Yashaswini, for all of us here in the room, is a micro insurance touching rural poor. So 3.4 million rural poor are touched by Yashaswini. Tell us a little bit more about it, Dr. Shetty.
It happened many years ago, more than 17 years ago, when Karnataka state had a consecutive 3 years of drought. Farmers lost the capacity to pay for the healthcare. So we came up with a concept of every farmer paying 5 rupees per month through the cooperative society. And the insurance is only for surgeries. And we networked with about 400, 500 hospitals in the state. So they can go to any of the hospitals and get the surgery done, only for surgery. including heart surgery or a brain operation. So that program became very successful, and after the government decided that we will not collect the premium few years ago, the Yashaswini was closed. And in that 12-year period when Yashaswini ran, we had 4.5 million farmers subscribing and paying 5 rupees per month. Government was the reinsurer. Because the government took the initiative, it became a successful program. And at the end of 12 years, I think about 1.3 million farmers had varieties of surgeries, and nearly 1.2 or 1.5 lakh farmers had a heart operation, all by paying 5 rupees per month. This is the power of a country called India with 1.4 billion population. We can do amazing things if we develop a platform to bring people together.
Wow, that's brilliant to hear, Dr. Devi Shetty, and I think it's fascinating to see the kind of work that you're doing to make sure that every individual out there can benefit from all the innovations that are happening in healthcare and get support. Now, I have one last question to you. A lot of technologists here in the room, and we all love talking about technology, but it's fascinating to hear about technology, what you have built in Narayana Hridayalaya and the in-house innovations that you have driven, be it in the form of Atma or Adi or Namaha or Meda, that is empowering thousands of healthcare professionals at your hospitals. I mean, you talked about the nurse station and how you're monitoring the data there to help the nurses run at their best. But tell us a little bit more on how you are driving these innovations in-house.
I like my digital tools. I like to fiddle around with this all the time. So my wife gets very irritated when I keep trying new things. And my latest fad or interest is flying the drone remotely. And I believe that the drone will have a massive impact on the way we run everything, including the healthcare, of course. So I get excited with all the digital tools. I like to try out everything what comes to the market, and I enjoy, because I believe that technology is going to be the greatest democratizing force. Technology, the rich people with technology will get what they always had, but poor people will get from technology what they can never dream of having. And we have proven in India that it's possible. We have dissociated mobile communication from affluence. Today, the richest man and the poorest person uses the same bandwidth. Maybe he uses a cheaper handset. Look at the entertainment. The richest man living in a mansion and the poor person living in a slum have the access to the same TV, the channels. So essentially, we will be democratizing all the essentialities of life using the technology. And healthcare is one industry which is ripe for disruption because it is an industry which is totally data driven. When you say doctors make very good diagnosis, what do you mean by data making? What do you mean by doctor making great diagnosis? That means that doctor can assimilate large number of data and put it together and come up with a diagnosis. So I believe that technology is the greatest gift this society we have received. Grateful to all the technologists who are sitting there.
No, we are grateful to you, Dr. Devi Shetty. It's been an absolute honor talking to you today. And thank you so much for putting India on the world map and seeing how we can leverage technology to democratize healthcare for all. Thank you so much, and wish you all the very best for your very tough day ahead. And we look forward to seeing you again at the GCC conclave soon. Thank you so much.
Thank you. Thank you. Thank you. Thanks.
For more content on tech and leadership, subscribe to NASScom YouTube channel and press the bell icon to never miss an update.